It was, Tom, following a scathing report by the Aged Care Commissioner, which demanded that Anglicare agree to a number of terms by 5 p.m. this afternoon. That included that the Newmarch House not take on any new residents, and that it also agreed to a government-approved manager. Now, in the last few hours, Anglicare has released a statement saying that it would agree to those terms. It says Anglicare will be making this appointment today. The new advisor will be appointed by Anglicare for a period of 3 months. Anglicare Sydney is confident with the support of the new advisor and the Commission, issues at Newmarch House will be resolved expeditiously. So residents and families as well, it says, can be now assured that there will be additional expertise to provide that additional safety measures here at the facility. The Premier, though, today welcoming the announcement.
The health experts have said to us that there's a number of issues that have to be considered in relation to the safety of residents. But I'm relieved if the regulators come in and has now put them on notice about revoking their licence. That's a good thing. That is a good thing. New South Wales welcomes that because the federal regulator has now put them on notice to say if you don't do X, Y and Z, we might revoke your licence. I think that's a positive step. What matters most is the safety of residents and their association with their loved ones.
Now, overnight, there have been 3 new cases in New South Wales, but a record 10,900 tests, and certainly welcome news for health authorities. They had been wanting at least 8,000 tests a day, so good news this morning. However, the bad news is that 2 of those new cases are staff members here at Newmarch House. Today, the Federal Aged Care Minister, Richard Colbeck, told Sky News that it's simply been unacceptable.
The death toll is not necessarily as a result of, for example, the number of staff that are there. It's the death toll is as a result of the virus getting into the facility in the first place at the scale that it is. And so it's not necessarily a matter of blame of any individual or party with respect to the deaths. It's the management of the facility, the communication from the facility.
Now, a Royal Commission into Aged Care will also look at how facilities across the country have managed the outbreak of COVID-19. Richard Colbeck says 25 providers have been impacted, but the majority of them have handled the situation well. Also happening in New South Wales today, Tom, is an inquiry into how the state handled the outbreak of COVID-19. We're set to hear from the Health Minister, Brad Hazzard, as well as the state's Chief Medical Officer, Kerry Chant. Aged Care, no doubt, will be a